Decisions about timing of measurement of bile acids are likely to change at different stages of pregnancy, and also partly related to how severe a woman has been in the past or how severe her symptoms are, even though we do know that itch doesn't always correlate too closely with how high the bile acids are. But I would say if a woman is in early pregnancy, and if she's had previous ICP, if there is a baseline that shows the bile acids were normal at the beginning or not too high, and if she's somebody who really did itch with the cholestasis before, they wouldn't have to be done too often at all. I might do another baseline at about 20 or 28 weeks if a woman has had severe disease before. But if her itch goes with the high bile acids, then developing itch is important. So if you know she isn't starting high, then I think when she starts to itch, we would check them. And it partly depends what stage of pregnancy she is and how severe she has been. So if a woman has already had a bile acid above the threshold of 100, you want to keep monitoring her liver to know that that doesn't get worse. And you might want to make sure the bile acids don't go extremely high, but maybe they don't have to be done so often because you know which group she is in terms of how you would want to manage her. The much harder groups of women in terms of how often should you do bile acids are those with bile acids below 100, but where you're worried they're going to go above. And I would say then the times that really matter are firstly as you're approaching 34, 35 weeks, and you certainly want to know where she sits there because that could influence decisions about delivery. And then from 35 weeks, I would say at a minimum weekly, I would check bile acids, and very often I would try to do them twice a week because of the concern that this is a woman who could suddenly develop very high bile acids, and I would want to know that to make decisions about delivery.